Thanks for tuning in to Global Elite Academy. If you have any questions about how to open a home care business, please go to globaleliteacademy.net. That is our website. Look up our phone number and give us a call. That's globaleliteacademy.net. So now, this is how to open up your IHSS in Colorado. Now, IHSS is called that in Colorado. IHSS is a government community-based program that's sponsored or paid for by Medicaid. I just did an audio on how to open up a Class B non-medical home health agency in Colorado, and I'm making this one because that actually goes with that one, and this is just for the IHSS. When you open up the Class B, they ask you if you want the community-based program, and you tell them yes, because it's going to be easier for you to get it approved. They'll just approve you at the same time instead of applying individually and getting approved. Now, in Colorado, for IHSS, they require that you have an RN working with your IHSS program. Not every state requires that. Colorado does. So there's a company called RN Now. And she has she has RNs for that particular reason, to help agencies comply with everything that IHSS is asking, like for nurses and stuff. So what'll happen? Like, you do the first, when the patient calls, you are going to do the first assessment yourself. You'll go out and do your assessment and get them signed up. Then after that, every year they have to have an assessment. You need the RN to do that, as well as if your caregiver is requiring any additional training, the RN Now will also send a nurse out to train the caregiver. Also, every time you put a new caregiver on a job, with the patient that is getting IHSS, they have to be I would just say they have to be okayed by or through the RN. So what I mean by, if you hire this girl named Maggie, let's say, and you put her with Miss Anderson, you'd have to call RN Now so they could send a nurse over and do a let me see, what do you call that? Like a skill checklist to see if the caregiver is going to know what everything to do with that patient. She'll have her going over certain things that she's supposed to do with the patient. It's a skill list to make sure that the caregiver can do what all the requirements are to take care of that particular patient. So every time you put like that caregiver on a patient that's getting IHSS, you'd have to call the nurse to come out to do the skill test. And then she'll come out and, like she might say, let's say the patient has ADLs and maybe she goes for a walk in the morning and um, you put on a TED hose. I'm just giving an example, a TED hose. So the nurse will come out and say, okay, let me see you give her a walk. Let me see how you put on her TED hose, like that, because she needs to check if the caregiver is able to do the duties that are assigned to her with the patient. And that's for every new patient that that you get from IHSS. And then, like I said, the patients they get reevaluated once a year. So then the RN is supposed to, reevaluate them for that. Now, I don't like to give other people prices because, I might be wrong on the prices, but the last time that I know that somebody had called them, um, the lady was charging, I think it was $250 a month. I think that's it now. I may be wrong. But so the lady who told me, right, she was going to hire a RN for her agency. But she told me that this was much cheaper because she only had to pay the lady $250. I'm not sure if it was a month or every time she used her, so I'm not sure. And it would have been cheaper for her. She said to go with this RN now rather than hire her own RN. So she actually went with the service RN now. And that'll take care of all of your RN needs. When you go to fill out the application for IHSS, even when you go to get your NPI number, I think, they're going to ask you, do you have a RN? Well, you would just put yes, because these people, RN now, like for example, that'll be, that's your RN. Now, I don't know if they have this service in other states. As of now, I only know that this is a private company, and they offer this service, which is a really, really good service. She has no competition. So she's the only one that's open in Colorado that does this. If you don't get her, then you have to hire your own RN to do this. Now, the agencies have told me when they went to hire their own private RN on Indeed, the nurse wanted to charge them $250 every time she went to do an assessment for the patient. And that's a lot. That's really a lot. So that's what she was saying. This service was much cheaper because, she's getting the 3 month, she's getting the evaluation done yearly. And then she was also getting the skill check done for, each new employee. And she just told me that it was just cheaper to go through RN now. And you can Google that information as to the name. The phone number. I think it's Ara. I know it's RN now. So you could just Google that. And, oh, wait, I have it right here. Wait a minute, I think I have it. Yeah, okay. Let me see if I can get you the phone number here for this. Anyway, you could just Google it, RN now. And here it is right here. 720 762 3611. And they're serving the Denver metro area and Colorado Springs. Again, it's 720-762-3611. And, she could tell you about the business and how much she charged. Because, again, I might be totally wrong on that 250. So, anyway, just call in. And again, I only know that she has this company in Colorado. Like I just told you, this is the area. I do not know, as of this moment, I do not know in another city what service provides this, or who provides this service in another city. Okay. Okay, so that's for your IHSS. When you get through getting your license, and everything for IHSS, you would go on their website, and you would talk to them. It's a phone number on there. Make sure your name gets on the website. They have a listing of all of the agencies that are licensed to take IHSS services in your area. So just make sure that your name is on that list. Because if a patient went on the website and they didn't, you want them to be able to see you, because that's also marketing too, if they just want to call you themselves. The social worker will, send patients to you, but the patients can also call you themselves direct. So you want to make sure you get on that website. And I think that's about it for IHSS. So again, IHSS is a community-based program that is paid for by Medicaid. Now, family members can also apply to take care of their family members. So, for instance, if you know someone that needs help, home care, and they have children, and their children want to be the mother's home care, just contact the agency, contact IHSS, and they'll explain to you how that works with the relatives. I do know that family members cannot work over 40 hours a week. If it's not a family member, they can work over 40 hours, but family members cannot work over 40 hours a week. Okay, so, your patient may want their daughter or son-in-law or whoever to take care of them. They might not want a regular caregiver. They just might want their family member. So again, they have the two programs: it's the family members or the regular caregivers. I don't know if the pay is different for the caregiver if they're a family or if they're not. I don't know if the pay is different. The only thing that I do know is that about the 40 hours. If they're relatives, they cannot work over 40 hours. That's the only thing I do know. But again, you could go on the IHSS website. There's a phone number, and that you can always call, and they'll give you all the information you want. Okay, so thank you so much. If you have any more questions you need to call, please go to globaleliteacademy.net, look up our phone number, and give us a call. Thank you so much. Have a good week.